So it is absolutely recognized that some people who get Lyme disease, probably a pretty small minority, well, not probably, certainly a very small minority, do get prolonged symptoms of all sorts of things. That's not in debate. There's no question that some people with Lyme go on to develop this kind of chronic symptomatology. What is debated is what's the mechanism of that effect. And the controversial part has been that there's been a lot of talk, and that I have to say, this talk has never been accepted by most mainstream medical practitioners. A minority, perhaps, but not the majority. The data is not great, but still, the notion has been amongst a small group of physicians and a large group of non-physicians that the infection can persist, and it can persist despite treatment. It is true that if you don't treat, in some people, the infection will persist and will go on to cause complications. We're talking now about people who get diagnosed, who get treated with a standard accepted treatment, and yet go on to these types of symptoms. And there is this branch, mostly non-traditional medicine, that says that the infection is actually still there. And so as a consequence, if we give these fairly long, fairly complex antibiotic regimens, we'll be able to get rid of those prolonged symptoms. That's the part that's not accepted by most people in mainstream medicine. They feel that these symptoms are not because of a prolonged infection, but they're rather a kind of an immune system problem. The immune system becomes dysregulated in a way and causes this type of symptoms. But that the ultimate treatment, which we don't have at this point, would be to somehow figure out what's going on with the immune system and see if we can fix it. But it is not a persistent infection that requires a lot of antibiotics. That's, I think, the gist of the controversy. I will say that this notion of very prolonged symptoms after an infection like Lyme disease is not a new idea, and is not a bizarre idea. So in more recent times, of course, we've had long COVID. In a lot of ways, what we call long COVID and what we call chronic Lyme disease, they resemble each other quite a lot. And in fact, we've known forever that some infections have this tendency to cause these prolonged symptoms. I mean, I think years ago. So this concept that these infections cause, in some people, something goes wrong. And the general feeling is that it's something not super well defined with the immune regulation, that something happens to certain people that we find hard to predict, where they get these prolonged symptoms. And they resemble what we call chronic fatigue syndrome, right? In reality, it's probably not all one thing. There are probably a variety of things and manifestations of different types of problems that overlap with each other. We don't have good tests, so we don't have good ways of sorting it all out. There's a lot of overlap, even with things that are completely different. So, for example, some of the symptoms of chronic fatigue or chronic Lyme or long COVID, some of those symptoms resemble depression. And in fact, some of these people are in fact depressed and respond to antidepressants. I'm not suggesting that most of them are probably not. Or if they're depressed because they have the symptoms. It's not the disease causing it. But I'm just pointing out that it's not at all easy to sort out when you have a patient in front of you who has this type of chronic symptoms. It's not at all easy to sort out what exactly is going on and how much of it is related perhaps to a past infection and how much of it might be other things. So and I think that was part of the problem, which is that for many years, people considered antibiotics to be close to harmless. And so the general feeling was you have a group of people, they're miserable, they're having really debilitating symptoms, they're having trouble with their work and with their daily lives. We have to do something. And even if the chance is small that it's some kind of chronic infection, antibiotics are fairly benign, and we have these people in a terrible situation. So why don't we just try at least the antibiotics? What's the harm? And what's become clear, I think, over the recent years is that antibiotics are in fact not that benign. It's true that millions and millions of people take antibiotics, and most of them don't have any real problems. But we do know these days that the normal bacteria, like the normal bacteria of the gut, are very affected by antibiotics. So it's not just side effects like some people get, allergies to antibiotics and rashes and stomach upset and this and that. But more importantly, we're beginning to understand that by disrupting the normal bacteria, particularly the bacteria in the gut, but probably the bacteria on the skin and elsewhere, by disrupting them with antibiotics, we actually probably do lead to long-term problems of different types, and that it is not a benign thing to just take antibiotics, combinations of antibiotics for long periods of time.